The establishment of Yumbe Regional Referral Hospital is a story of hope amidst a mountain of challenges. Consistent and concerted efforts by stakeholders that paid off richly at the end. Welcome to the newest referral hospital in West Nile. 84-year-old beams with excitement when it comes to the fairy tale story of Yumbe Hospital. A sudden astronomical rise from an old rugged district facility to a state-of-the-art regional referral hospital.
Lakini udido jodi si medical ampogo ba markito dau ko uskito tabo urudi matigari marumusu adrongati.
The old hospital, built way back in 1969 under the Obote One government, was nowhere near good, and by 2012 stakeholders including the then District Chairperson Tabani Yassin put up a spirited fight for an urgent upgrade.
We made a special visit to meet the President of Uganda, His Excellency Yoweri Museveni, in his country home. When we had that trip, a delegation of close to 60 members went, and I was personally in that delegation. One of the critical issues that we raised was the issue to do with the creation of more constituencies, because we only had one constituency. And the issue of the hospital was also raised, which sparked genesis to have this regional referral hospital here.
As lobbying continued, a sudden war erupted in South Sudan. 250 square kilometers of land in the Bidibidi in the district was allocated as a settlement. All social services were severely crippled, with hundreds of thousands of the refugees having to share the already ailing facilities. For the staff, working conditions became unbearable.
I didn't want to remember the past, but I have to tell you the truth. Some 5 years ago, the infrastructure was so debilitating, with leaking roofs, all window glasses all gone. Things were worse. Concerning water, we would fetch water in jerrycans from the sub-county across the road, about 200 meters from the hospital, where every delivery in maternity ward, the requirement would be to 20 liters of jerrycans. That is 40 liters of jerrycan. For mothers who would fail to push normally, then we send them to theater with at least 4 jerrycans of liters. Each one of these is 20 liters as a requirement. You can see how life was hard. Now imagine in a situation where a mother comes in the night, where maybe from very far, and they would have no access to go and fetch water from outside.
During this time, Dr. Nasur, perhaps the longest serving and only senior consultant here at the hospital, saw it all and fondly remembers the desperate attempts at saving lives.
Yes, that time I think one of the challenges we had, there was a problem with the power. There was a problem, even funding was a very big challenge. So those days we used to do some operations using even the lights from the phones.
Just you charge phone from the trading center using generator. Then during the night when you're delivering mothers, you put the light of the phone on, if you have, and you put in the mouth like this, as you conduct the deliveries.
So that time I sat with my management team, because I was also by then the medical superintendent. I sat with my team, I said, how do we move on? Because we continue getting, because sometimes you would get mothers or children who needed a referral, but the parents say, we are not going there because we do not have money. And therefore, we looked at what was feasible within those means, and we innovated. We got a motorcycle lamp because it could get a small battery, and that helped save a number of lives here. And I think when that one also went to the media, it added on the need to have this facility renovated.
However, in 2018, the tables suddenly turned. A new light shone at the end of a long tunnel, and alas, Yumbe would never walk the painful path ever again.
When the hospital was expanded and the status elevated from a general hospital to a regional referral hospital, more departments have been created, more positions for specialists have been created, and the different cadres, right from consultants, senior consultants, specialists, medical officers, nurses, midwives, laboratory staff, support staff, and the like. Even the funding for service delivery, the non-wage, and for medicine have also been increased.
When you touch the right buttons, you talk to the right people. Sometimes you don't need, but you need to talk and continue lobbying and talking to the right people. That has helped us generate this.
Locals joined hands to ensure that work was smooth, for they desperately needed this upgrade.
And as a community, we provided enough security to ensure that the workers here, people around this place, actually we are very safe. And we also joined hands in providing some materials nearby, locating them, though they were bought, but we were able to coordinate and locate.
When this hospital closed doors for rehabilitation and expansion, the community were brought in, right from the leadership up to the local people who participated in the construction.
Finally, the year 2021 ushered the long-awaited treasure. The state-of-the-art hospital was commissioned by the president, and in the blink of an eye, working conditions changed significantly.
Wow, there's a lot of improvement. First of all, we used to share even rooms. In one room, we would have 2 family heads. But now each one of us has a room, bedroom, sitting room, even extra room plus corridor and so on. Life is easy.
Generally, our working conditions are okay. The work is moving on well, and we are very grateful.
Right, being in this facility, there is a chance for us to learn. At least I appreciate that we have been absorbed into various committees, the MTCs, we have some CMEs where we are the ones who are presenting, we have the ward rounds. We've been allowed to do a hands-on, that someone can let you make an order, someone can let you receive orders, and so by having such kind of exposure, I'm optimistic that by the time we leave, we are going to be fully qualified pharmacists.
For the locals, this couldn't have come any time sooner. They would no longer have to travel very long distances in search of quality health care. On any ordinary day, the swarm of people and activity in the facility is testimony to this new status. Despite the obvious picture of massive improvements, the upgrade into a regional referral has come with new demands, especially on human resource, posing the biggest challenge to the facility.
The issue of staffing is a very big challenge. Right now we have 2 structures operational, because recently Ministry of Public Service has approved a new structure, which has a total number of 1,195. When we look at that structure, we realize that if we now take the structure of 1,195, the current staffing level of Yumbe Regional Referral Hospital is 10.8%. You can see the challenge we are going through. Managing a whole regional referral hospital where we're supposed to have 1,195, we're only having 129 staff. In terms of percentage, only 10%.
I know we've been moving slowly, but we are working towards having this improved. This year, the government gave us an additional 1.1 billion to recruit staff. And as I talk now, there is an advert running to bring on board some of those staff. We've been having only one specialist, who is myself, in the area of pediatrics and child health. The advert that is running, we are getting now the other specialists on board. This is a plus on our side.
For the local leaders, this is the new phase of advocacy. The mission is relentlessness until all the gaps are filled. As you walk on any ordinary visit, not all the picture is entirely rosy yet, but all the stakeholders who walked through the intense pain during the dark days are filled with utter gratitude to the government for how far they have come.
We are extremely very happy to the government of Uganda this time. The whole of West Nile, actually, this is so far the project, the biggest project that the current government has given to Yumbe district. Not only Yumbe, for West Nile. So we are very happy for government for that. This time, this structure alone has employed very many people, and it has also brought very many employment opportunities to our people.
I'm very happy. First of all, to the Minister of Health, to the leadership of the district by then, and also the government of Uganda led by His Excellency. I think without him, this wouldn't have been. But also, the coming of refugees also helped drum up this. And we now see government has increased the number of referrals. But as West Nile, we are very satisfied that we are the only region with at least 2 regional referral hospitals.
Now, for the government of Uganda, this one is, it has been an overwhelming support. Right from the word go, from the planning, identification of the donor, adding value, adding some money, because the government also had to put in some money for this rehabilitation, and then the supervision of the project, the monitoring. Whenever there were site meetings, team would come from Kampala to do the site monitoring. And then finally, when the site or the complete project was handed over to government, the process of validating the staff who started the work here by the Health Service Commission, that was also a very good activity. The government continues to fund us up to now, and for this financial year, government has allocated for us an amount of 1.1 billion for recruitment of staff.